the answer is autism. They weren't psychotic. So the exam question is going to read something like, in the film Teaching Language to Psychotic Children, what was the likely diagnosis of the children? You're all going to get that right because it's autism. People who didn't attend tonight will probably put psychosis and they'll probably get it wrong. The second question was about punishment. And it was about the kid who was self-abusing so badly he had to be in restraints the whole time. Which was more effective with him? Was it extinction? No. He hit himself 10,000 times. But punishment, did you see how effective punishment was? They shocked him, what, 2 or 3 times? And the behavior was completely suppressed. And then to see that transition of going from just hitting himself constantly to being pro-social and smiling and hugging and stuff like that, I thought that was amazing. I thought it was just wonderful to see. Okay, so that's it for the films. I do something near and dear to us all. Now you did very, very well on the last exam. The average grade was an A-, so let's see if we can do that again, ideally. So this is cumulative. So I'll go through some of the questions. You should know, let me just read this question to you, question 1, see if you get it. Just before you give your dog its food, you say, good dog. Your friends come over to visit and notice every time they say good dog, your dog starts salivating. The words good dog have become what? Yes, conditioned stimulus. You've been paired closely with food. I'll read the second one too, just for fun. You're attempting to determine what is maintaining a child's problem behavior in school and observing the child in the classroom. You notice the child looking around the room, smiling and winking prior to acting out. When the child acts out, his peers laugh. What is likely the reinforcer that is maintaining the behavior? We talk about different types of reinforcers. And for problem behavior, it's very often social, right? So it's social positive reinforcement. We did talk about tokens and token economies. You should know what tokens are. Tonight we talked about thought stopping. So if you have a scenario of forcing thoughts out of your head, that's a cue that it's thought stopping. Thinking the word no or saying the word no. We talked about behavioral momentum, about if you're having problems getting a client to react, fall back on a behavior they do know how to do, develop that momentum, and then you can teach them new things. I get 2 questions out of the movie Teaching Language to Psychotic Children and Development of Natural History of Psychosis. So if you saw the movie, great. If not, pay money to someone who did. You should know what are the symptoms of a panic disorder. So we talked about this: chest pain, shortness of breath, dizziness, etc. If you're in an extinction program, or you're dealing with an extinction program, and the behavior drops off to 0, but then it comes back, remember what that's called?
Extinction burst.
Yes, spontaneous recovery. What is the goal of cognitive restructuring? Changing faulty thinking patterns. We talk a lot about exposure therapy. So with exposure therapy, it's ideally a progressive thing where you start out at low levels of stimulus and you progress to more advanced. Response generalization. Remember, response generalization is learning different responses to the same stimuli. Another question about token economies. What are the most and least important things in selecting a token? What's another name for an unconditioned response? So an unconditioned stimulus response, your reflex. That's something that's unlearned. We naturally have reflexes. Greenspoon's covert behavior modification uses what kind of reinforcer? We just talked about it. Nonverbal communication. What is a response clause? in a token economy. Identifying dysfunctional thoughts and using hypothesis testing and reality checking to counteract them describes what kind of therapy? Cognitive. Modeling. You know what participant modeling is? So participant modeling from tonight's lecture, that's where the therapist would actually model the behavior in front of the client. Fixed interval schedules. You should know your schedules. So fixed interval, variable interval. You should know your duration schedules, your fixed duration, variable duration. You should know what counter control is from tonight's lecture. You should know the difference between obsessions and compulsions. What is a conditioned punisher? So a conditioned reinforcer is anything that's closely associated with reinforcement. Same with punishment. If you're closely associated with punishment, you become a conditioned punisher. What is rational emotive therapy? So remember, rational emotive therapy is more confrontational. If you're giving someone a kind of a homework assignment and say, well, I'm like I used in class, I'm a failure. Okay, well, now you have to list 10 ways that you succeeded. Or no one wants to talk to me. That would be a common thing. Well, now you have a homework assignment. You have to actually go out and talk with 20 people to actually test that. Hypothesis testing, you should know what that is. We've talked about prompts quite a bit in the past. You should know what fading a prompt is. What are the symptoms of depression? What is a conditioned versus unconditioned stimulus? Remember, if it's an unconditioned stimulus, there's no learning. You naturally respond to it. What is the contingency of reinforcement? We've talked about that several times. Antecedents, behavior, consequences, ABC. Overshadowing and masking. I hate those. I need to take this question now. There's no reason for knowing the difference, but you should know them because there's one exam question on it. You should know about the advantages of tokens, having a token as opposed to other forms of reinforcement. If a behavior occurs only in the presence of a specific stimuli, that stimuli is said to have what? So the behavior only occurs when that stimulus is present.
Stimulus control?
Yes. Excellent. Stimulus control. Should know the symptoms of agoraphobia. This is an interesting question. I really like this one. I'll read you the question, but without the answer. You want to reduce a client's negative behavior or eliminate it altogether, but your client has a low frustration tolerance and has the potential to act out aggressively. Of the following options, which is the worst choice? You can probably guess what it is. You should know what flooding is. Again, with old schedules, variable ratio, fixed ratio. In terms of people you need to know, Fred Keller, of course, B.F. Skinner, Joseph Wolpe, and Ivan Pavlov. You should know what they're associated with. So with Skinner, he's the father of behaviorism. Pavlov did respondent conditioning. Wolpe did reciprocal inhibition, which led to systematic desensitization. And then Fred Keller did the personalized system construction. Is there anything else? Escape and avoidance conditioning. You know what those are? which of the following, I'll just read the question, which of the following is not recommended for programming stimulus generalization? So if you know stimulus generalization, you know how to set it up, then you'll be in good shape. You should know what systematic desensitization is. You should know what a prompt is. And then you should know what covert sensitization is. Remember, with covert sensitization, you're sensitizing them via imagery. So they're asked to examine extremely or imagine very negative consequences for behavior. So it's a form of aversion therapy, but it's covert. Any questions?